Who's at risk? Who's most at risk?
Well, generally speaking, all men are at risk. And in the United States, 1 out of 8 men will be diagnosed with prostate cancer. And there are some things that can make it more likely that you will develop prostate cancer. Those are called risk factors. One of the ones that you can't control is advancing age. This is a disease that affects men of a certain age, over the age of 50. But there are others. If you have a family history of prostate cancer, it more than doubles your risk of getting prostate cancer. African Americans have some of the highest risk of prostate cancer. And not only that, they are generally diagnosed at earlier ages, more advanced disease, and have a higher risk of dying. If there's a family history of other genetically grouped cancers like colorectal cancer, breast cancer, gastric cancer, that can increase your risk. And certainly there's a group of negative lifestyle factors that maybe have more of a loose relationship, like smoking and obesity.
And Dr. McFadden, there aren't always symptoms for prostate cancer, but what are some of them?
They generally revolve around difficulty with urination, whether it's trouble urinating or maybe it involves more frequent urination, especially at night. There can be blood in the urine, and in more advanced cases, it can lead to back and hip pain. Now, that's when it's spread to other areas. But here's the key. Just because you have these symptoms, it doesn't mean you have prostate cancer,
but worth maybe looking into.
It's certainly a red flag.
Let's talk about when men should start screening. It seems like it's been changing, or we've heard the age got a little younger, or no?
Well, it's certainly younger if you're high risk. So if you have a family history or if you're African American, you should begin screening at 45. In the 50s for most men, average risk. But here's the key. Most men avoid and really don't want this test because of the dreaded exam. Most people think it's the finger exam, but the American Urologic Association recommends just a PSA. It's a simple blood test.
It's a blood test?
It's a blood test that can be checked, that even if it's high, it doesn't mean you have prostate cancer. It needs to be followed. There may be more testing, maybe biopsies, and something that can be evaluated over time.
All right, quickly, let's end on treatment. What does that entail?
So prostate cancer, one size doesn't fit all, right? When we think of cancer, most people have a dread about the word cancer. This is a particular type of cancer that may not need any treatment at all. You may just actually monitor it over time to see how it influences, especially if you're considering the potential risk of some of the medications or treatments that you're going to be offered. It may be unwarranted. So you consider, if you have local disease limited to the prostate, procedures such as surgical, cryotherapy, which is a procedure where you freeze or burn the prostate, or radiation. If it's spread, we're talking chemotherapy and other medications that lower testosterone that can feed prostate. But there is hope. Most men with prostate cancer, 98% of people with prostate cancer are alive in 5 years.
Oh, that's a blessing.
So there is hope. That's the good news.
All right, and we're talking about it, which is important.
Absolutely. Dr. McFadden, thank you.
Yes,